Okay.
Yes.
But for a woman, you're going to have to, okay? You got to make them feel comfortable, all right? Whether you're a female or a male, all right? So what you do is, it sounds silly, but you just put a towel some way over them like that. I let all of my patients wear their bras. You don't have to have them take them, please. You're only asking for trouble, please.
Okay.
Now, if you have a big bosomed woman, okay, what you're going to do is ask her gently, if you have to go palpate in this area, you're going to explain to her profusely what you're doing. I have some important, you're a female, okay? You first draper, you have them keep their bras on, okay? And you explain to them that you have to palpate for area in the center between your breasts, okay? So it's a sensitive area. I need your permission to do that. Is that okay?
No problem, go ahead.
Okay. Now, sometimes if you have to make them feel comfortable, if they give you a hard time, use their hand first and palpate. You could palpate the areas. You could feel through those areas. And when we get down to the pubis, you're going to see that you can actually feel the bone, the pubis bone, through their fingertips. Then replace it with your finger, okay? Now, the other way is if they're a big-breasted woman, you ask them, could you please distract your breast to one side? So if you're going for this side here, like say the kidney points up here in between the ribs, which is only 0.5 chung from the sternum, okay, or from the midpoint actually, you ask them to push it aside for you, okay, so that you could press in that area and find the points, all right? So that's very important, people, because you want to make them feel comfortable, all right? If they don't feel comfortable with you, they're not going to come back, okay? They're not going to come for more treatment. What I also do, and I showed in my topical class, and I had most of you in my topical class, but some I didn't, get a Mylar sheet. You know the Mylar sheets, okay? Those are sheets that they use when they run the marathon or when they go camping to maintain the heat of the body. It's also a very light sheet that will lay just on top of the needles and not disrupt them or cause any pressure that could cause any pain for the patient. It also keeps them warm because when you acupuncture, you're moving the chi and the blood. So they tend to get cool laying down there. So if you put that Mylar sheet on them, it maintains their temperature. And they feel protected. All right, they feel that they're not out in the open, okay? Because I've seen some people, they throw towels on them and stuff, but you know what? It presses down on the needles, and then you're going to have problems, okay, with the patient. All right, so that's basically it. All right, but being that he's not a female, all right, so up here we have our what? What's this? Jugular notch. Later I'm going to show you how to palpate and see if you can get, I want you to palpate the level of the vertebra that's at, because I want you to start realizing how the rib cage is so angled downwards, all right? So I want you to, that's why when I say this is at T2, I want you to see how that is at T2, okay? All right, so that's a superior angle of the manubrium. You come down, and he doesn't have one. Yes, he does. But it's very, and this is why it's important for you to palpate a lot of different people. His sternal angle, his manubrial sternal joint, his angle of Lewis, whatever you want to call it, is very shallow. It's not a big ridge to palpate, okay? So, and you have to palpate that because that's at T4, T5 disc space, and across from it should be the second rib. He's very shallow. All right, here's his second rib, right in here. All right? Now you can't, no, that isn't his second rib. Right here is his second rib. His is up higher. His is up, all right, so here's where his manubrium is, from here to here. This is his sternal angle. Very, very shallow, all right? And right here is his second rib, all right? So now, the intercostal space is named for the rib above it. So this is your second rib, so below it here is your second intercostal space. Above it would be your first intercostal space, all right? Just like with the interspinous, what you're palpating for the posterior points, okay? You're palpating between the spinous process of the superior vertebra and the inferior, the vertebra inferior to it, but that space is named for the superior vertebra, okay, the vertebra above. I think I just confused you, because I confused myself.
Except for the cervical, right?
Right, because the cervical, right, what's the problem there? We have an extra spinal nerve root coming out, right? That comes out. You're talking about how they come out on top?
Maybe I confused myself. Right. Something about there's 8 spacing and 7 vertebrae.
There's 7 vertebrae, there's 8 vertebral nerve roots coming out, cervical nerve roots coming out, because they're coming out horizontal or almost like on top of the vertebra that it's named for. All right, but you're still counting the interspinous spaces for where, the bladder points or the different points that you're going for. Okay? All right. So that's that. So now below it then is your body, all right, of the sternum. And palpate and find the most inferior point would be your xiphoid process, and then just above it, right in here, where the angle of the costal angle ends is at that xiphosternal joint, which is at T9. The xiphoid process is at T10, all right? And then I'm going to ask you, like, for instance, and you know what, people? I know they tell you in point location that, what is it, at the nipples? Yeah, it's right at the 4th intercostal space. Are you going to palpate somebody's nipples, especially a woman's? Come on. The woman's like mine. Gravity is taking its toll, people. So you're not going to get it at the right level. I'm sorry. All right? So, so you can't go with that. All right? So you've got to really, the only place you can really find that is from that sternal angle. Okay? So be aware of that. So if we were to find his sternal angles right here, actually, I'm finding his rib first because his sternal angle is just not that prominent. All right, so here's his second rib. All right, here's your second intercostal space. Here's your, and stay close to the sternum when you're palpating the people, all right? Don't go over their nipple area, okay? Find the sternal body and go close to it and find that intercostal space when you do it, okay? Even with them pulling their breasts laterally, you're going to have to go close to the sternum, okay? And also be careful, because those areas very often are tender also, okay? So be ginger with the way you palpate. All right, so I'm going to ask you to palpate different intercostal spaces, okay? And you're going to feel when you get down towards the 7th rib, sorry, no. All right, what do we do in a case like that when we have somebody that's ticklish? That's right, you use his hand. Or the other thing is going, you just got to, you can't go lightly with someone like that, okay? But you can't go really deep that you're going to hurt them. So you're going to go in, I hate to say aggressively, it's not aggressively, but you're going to go in deep right away, all right? With that, but not hard. How can I say it? Yeah, no piercing, just firm. Just go in firmly, and then you'll bypass sometimes that sensitivity, that ticklishness, all right? No, I guess we did with him, right?
Knock him out.
Knock him out. All right, so that's that. Now, the anterior area here is then you have your rectus abdominis muscles. So if he was to kind of flex, you're going to feel that muscle. If he rotates to this side with his torso like this, bring your upper part like this, all right? You're going to feel in here his external obliques, okay? And internal obliques is he's going to rotate to the same side, all right? And you'll feel the contraction. So put your hand around in this area here, okay? Now, so that's that. Transversus abdominis, it just has to do with compression, so don't worry about that one. All right, So the other abdominals that we did practice with was the posterior wall, and we named them already, the quadratus lumborum, the psoas major, minor, some people don't have the minor, don't worry about that, and the iliacus. The psoas major, you find the umbilicus, you find the ASIS, which is right, oh, sorry, he's ticklish again, sorry, right here, okay? Here's his umbilicus. Midway, you have him take a deep breath, and then let it out, and then you go in deep. Sorry. Why do I get the tickly ones already? Get somebody up here that's not going to be ticklish.
Oh, no.
You don't want to do it? Get over here.